Hello everyone, myself Nisha Malik, Assistant Professor from the Department of Physiotherapy, RPIIT Karnal. Welcome to our YouTube channel, which is RPIIT Academics. If you like the content of our videos, please like, subscribe, and share our channel. So, in this video, we're going to talk about introduction to resistance exercises. First of all, definition of resisted exercise. So, resisted exercise is any form of active exercise in which dynamic or static muscle contraction is resisted by an outside force applied manually or mechanically. Then strength. Muscle strength is the greatest measurable force that can be exerted by a muscle or muscle group to overcome resistance during a single maximum efforts. Then what is power? Power is a muscle power is defined as work produced by the muscle per unit of time. Power is equal to force into distance over time. Then what is endurance? Endurance is the ability to perform low intensity, repetitive or sustained activities over a prolonged period of time. Then types of muscle work. First is isometric muscle work. In this type of muscle work, there is increase in tone of the muscles without any change in the muscle length. For example, isometric strengthening for neck extensors, the collapsed hand behind the head is pushed back by the head. No movement of the head or neck occurs, but the tone of the neck extensors increases. Then isotonic muscle work. In this type of muscle work, there is change in length of the muscle while it maintain an even tone throughout the contraction period. This is of two types, concentric and eccentric. In concentric work, here the origin and insertions come closer and the muscle length shortens. For example, getting up from a chair, knee and hip extensor contract concentrically to bring about extension in these two joints. Then eccentric work, here the origin and the insertion go away from each other and the muscle length increases. For example, sitting on a chair from standing, knee and hip extensor contract eccentrically to bring about flexion in these two joints. And then in concentric contraction, the force generated by the muscle is greater than the resistance. In isometric contraction, force generated by the muscle is equal to the resistance. In eccentric contraction, the force generated by the muscle is lesser than the resistance. Then next is principal resistance exercises. So, in principle of overload, first of all, if muscle performance is to improve, a load that exceeds the metabolic capacity of the muscle must be applied. That is, a muscle must be challenged to perform at a level greater than to which it is accustomed. Overload can be applied by increasing the intensity or volume. In strength training, the intensity is increased, whereas endurance training, the volume, that is frequency, repetition, and time is increased. Then SAD principle, specific adaptation to impose the demand principle. Adaptation produced by the training are highly specific to the nature of the stimulus or overload applied. In SAD principle applies to all the systems of the body. The adaptations are specific to strength, power, endurance, functional activity, joint angle, sequence of muscle activations, energy systems, and virtually all that other variable present. Principle of reversibility. This is third principle. The adaptation achieved though resistance exercise persists as long as the resistance exercise is performed regularly and go back gradually to the pre-exercise level once the training is stopped. This means the effort of resistance training are reversible. Inter-individual variability. Every individual responds to resistance exercise in a different way. The similar stimuli may bring about a lot of improvement in one of patient and no improvement in other.